Much. Let's bring in Dr. Ashish, our friend from the Brown University School of Public Health. Dr. Jha, thanks for joining us again this morning. Big news.
It's really big news. It's exciting. I'm obviously thrilled. Look, this is like really a high level of efficacy. 100% of kids were vaccinated. No side effects that we're seeing so far. So we've got to have the FDA do the full evaluation, but I think this is terrific.
So they're going to do the full evaluation, but is this really enough? I mean, this study for them to move forward?
You know, I think it is, George. And part of it is now we've had tens of thousands, maybe even hundreds of thousands of kids 16 and 17 who've gotten vaccinated already. We've had young adults get vaccinated. So this is not being looked at in a vacuum. We have a lot of data on young people. This just adds to that data. So I think it's going to be enough for the FDA to expand its authorization to people 12 and older, but we'll have to see.
And should that happen by September for the new school year?
I think it will happen. I think we're going to have plenty of vaccines that kids 12 to 16 will be able to get vaccinated this summer. That's my expectation. And we'll see about younger kids, of course. But for people 12 and older, I think this should be pretty doable by September.
I want to ask you about another finding that's coming out of the state of Washington this morning. They're finding that about 100 people have reported after taking the vaccine that they may have COVID-like symptoms. What does this tell you? How big a concern is it?
Yeah, so we've got to explore this a bit further. I mean, obviously, after vaccination, until you're fully vaccinated, you're still vulnerable. Even when you're fully vaccinated, these vaccines are not going to be 100%. They're 95% effective. When you think about 100 million people having been vaccinated, we're going to expect to see hundreds, if not even thousands over time, still get infected. I want to see, are they getting really sick? Are they getting hospitalized? So more to sort out, but not totally unexpected.
And we've been living with this dynamic now for the last several weeks. We're seeing all this good news on the vaccine front. The vaccines are ramping up all across the country, but so are cases.
Yeah, that's the challenge we're in right now. These variants are here, as we've been predicting. The UK variant is now dominant across the country. I think the vaccines are going to win this race. We're going to be able to get enough people vaccinated to get this all under control. But it's going to be another 4 weeks or so. And I really want to make sure that we just stay careful until then and don't have unnecessary infections, hospitalizations, and deaths.
Dr. Jha, thanks very much for your time and information this morning. TJ?
All right, George, we turn now